Devrim Hocam, once again, we're here with a brand new program for Cynomedic viewers. As always, Devrim Hoca is the one who keeps reminding everyone. This time, let me be the one to remind you. Talent thrives on appreciation. Science and art flee from places where they are not valued. That's why you should show interest in the channel. Watch the videos. It's also important to like and share them.
Gaffar Hoca gets really upset.
I do get upset.
Yes, he puts in a lot of effort. Yes, he really does. He gets upset because you don't show enough interest in these things. Look, I'm retired now, but I can't say the same for my mind and heart.
Then let's say engine. Yes.
No. Everyone, grab your clapperboards. 3, 2, 1, action. Hokum, what's the topic today? Is there a gaff?
I have a request.
Go ahead, my friend.
My aunt has a cataract in her eye.
What kind of curtain?
Like, what?
Curtain?
You mean like a sheer curtain? That's what I want to ask. Like a Venetian blind? Sheer? Or thick, like blackout curtains?
So can you see through it or not?
I'll ask those separately, man.
Just one curtain? Do you remember the old curtain? A single curtain, not a sunshade, and sheer separately. Yes.
I think I remember it being like a sheer, it could be sheer, Hokum. So does a curtain really come down?
It does? It does. The curtain comes down. Some of these curtains are see-through, some aren't. Yeah.
But until very recently, he truly wasn't mentioning any particular kind of curtain at all, Hokum. I guess this is something that developed suddenly.
Now, there's a very important difference. Did it come down over both eyes or just one? Yeah.
Both eyes, Mr. President?
Look, this is even more interesting. If it came down over both eyes, is it permanent or temporary?
We genuinely don't know. I mean, it certainly came down for a moment and then it completely went away.
Yes.
Maybe his blood pressure dropped, or look, I never even asked. He was using something else for his blood pressure.
If he's diabetic, maybe his blood sugar dropped.
So, if his blood pressure dropped, if we fix his blood pressure, or if his blood sugar dropped, if we fix that,
Again,
it gets better. I mean, there's nothing that would require surgery. But, Professor, what if it's not a temporary curtain caused by other reasons? His blood pressure is normal, his blood sugar is normal, but the curtain remains?
in that case, we need to review the eye-related pathologies. Friends, in order to understand the pathologies related to the eye, we first need to review the anatomy of the eye.
Yalchin, then put up the diagram of the eye's anatomy on the screen.
Start with an eye, show us an eye.
Show us an eye. Just show the eye from the front side.
Now the cross-section of the eye from the side. We can see it, friends. Yes. At the very front, there is a layer called the cornea.
Yes, doctor, this...
Think of it as something like transparent glass. It partially lets light in as it is, and depending on the intensity of the light, it contracts or expands.
It's in front of the iris, which gives our eyes their color.
Yes, right in front of the iris. Okay, light passes through here into the eye. And behind this, there is also a lens.
Lens.
With this cornea. Between the lens and the cornea is the anterior chamber. There is a space there. The lens must enlarge and shrink to provide the adjustment for near and far vision, which is called accommodation.
Doctor, can this cornea get inflamed?
It can get inflamed. The cornea can get inflamed. Inflammation of the cornea can cause this membrane to appear.
Then it could be because of that.
We call this keratitis. This can happen suddenly or gradually. But of course, this causes a change in the cornea itself. Usually it comes with discharge and itching.
Redness with redness.
It progresses. So when eye doctors see this, they immediately recognize it.
Well, doctor, what about the lens?
The lens can lose its clarity. What does that mean? Its density changes.
Is this what you mean by cataract, doctor?
Yes. In fact, especially gradually. If a curtain descends, in the past, before these eye examination devices existed, doctors would look into the eye and see the opaque lens inside, meaning they would see the lens that was no longer transparent, and the old physicians would tell patients that a curtain had fallen over their eye.
So, it means that in the case of cataracts, the lens will need to be replaced as well.
Since they couldn't replace the lens in the past, they would just cancel it.
with glasses as thick as the bottom of a water glass. Professor, now there are also smart lenses available. They serve both the function of the lens and the function of glasses.
Come at the same time. So not only do you get rid of cataracts, but you also get rid of glasses.
Yes, that's a separate area of expertise.
Behind it, behind the lens, there's a space. Inside that space, there's a gelatinous, dense fluid. This is called the vitreous. Yes. The space containing this fluid forms the posterior chamber. The engineer of this fluid itself is transparent.
Yes,
If the nature of this fluid changes in any way, the refraction also changes.
so this fluid is constantly circulating, forming.
That is, if the fluid becomes cloudy or its density increases, this curtain can appear again.
What was behind it, Professor?
Behind this, there is a layer we call the retina, a bundle of blood vessels and nerves.
So to speak,
So when the image passes through all these parts and forms on this layer,
when it lands there,
it turns into a signal here, a sensor. This retina, the sensor layer, turns into a sensor, and the new stimulus generated in this sensor is sent to the brain via the nerve.
Professor, I've heard of something called retinal detachment.
Yes,
What happens there?
it's when the bundle of blood vessels here separates from its place.
The nerve.
Yes,
It separates directly from the blood vessel,
yes, that causes the detachment. This is the back wall.
usually due to trauma or constriction.
It can also happen without any reason.
Yes, it can also happen without any reason. Yes. Of course, in my life, a few times this happened to my friends on the football field.
Diabetes is one of the main causes of this.
Yes. Professor, retinal detachment is an emergency
Needs immediate intervention.
and treatment. Otherwise, it can lead to blindness. Then, Professor, there's also something called the macula. It's very common among the public.
Now, there's the most sensitive part of the retina called the macula. It's the area where the images form most clearly. If degeneration occurs in the macula, meaning due to the person's illness, trauma, or aging, the changes that happen in the macula are referred to as macular degeneration or yellow spot disease. When you look with your eye, you see a yellowish area appear. This is called macular degeneration or yellow spot disease.
Yes. Professor, we have understood that in general, there are 5 different types of vision loss originating from each of the layers of the eye. Yes. Some of them are severe and develop suddenly, and we've learned from you that they require immediate intervention. Whether it develops suddenly or gradually, ultimately, an eye doctor must.
Yes, these are diseases that an eye doctor can distinguish and direct the treatment for.
Diseases? Professor, now the optic nerve is, of course, a nerve through which the signal reaches the brain directly without stopping at any other station. That's why we've said in previous programs that eyes don't lie. They don't. The eyes are not the mirror of the heart, but actually the mirror of the brain. Look, friends, we're not saying the eyes are the mirror of the heart. The eyes are the mirror of the brain. Professor, before we wrap up the program about the eye, I'd also like to briefly ask you about some well-known sayings related to the eye. For example, there's a saying, eat the oil of your eye, eat the crust of your eye. But I mean, for example, we also talked about the anus. There aren't such well-known sayings about that.
Yes,
Then there are phrases like, the light of my eye, let me eat the oil of your eye, let me love your eye. I mean, Professor,
the light of my mirror.
the light of my mirror. If there are any others, let our viewers write them in the comments. But really, there are so many proverbs and sayings about the eye.
A lot.
A lot.
Now, something interesting?
The apple of my eye.
There's something interesting in etymology. With water source, comparison of the eyes. In other words, the place where water resources are located is called a spring.
To the eye.
It's called the eye, fountain.
Eye fountains.
And in Persian, the word for eye is kind. So this is,
From tears.
yes. Now, the analogy between the fountain and the eye, the fact that this overlaps in Arabic, Persian, and Turkish is a very interesting thing. The place where it all begins. Maybe it's seen as the source. That's why fountain, eye, spring, and ayin are all the same words. Please pay utmost attention to your eyes.
Professor, if we close like this, take care of your eyes as you would your own.
Yeah, exactly. Now, when you say take care of your eyes as you would your own, it could be understood in another way. Just take care of it as best as you can, Adam.
My dear friends, that is truly all we can genuinely offer you through the digital screen at this moment. We sincerely wish we could accurately diagnose and effectively treat each and every one of you from such a significant distance, but unfortunately, current circumstances and prevailing conditions simply do not allow for that possibility.
With artificial intelligence, we're heading in that direction.
We're heading in that direction, but for now, we're moving forward with the natural intelligence that created artificial intelligence. Goodbye.
Goodbye. Stay tuned to Cinematic